Okay, I think we can get started. Again, welcome to this event, which is the beginning of a series on science communication that we're organizing at the School of Media and Public Affairs. I am Sylvia Weisbord, I'm the director of the school. And before we go to the panel, I want to thank the CMPA staff who has worked so hard on this event, particularly Jen Halpin, Sarah Krishy, and Doug Zimmerman, who are the so-called behind the cameras and been working on this for a while. And the topic of today is on news journalism and the global pandemic. These are issues that are central to the educational mission of the School of Media and Public Affairs. It is central to the teaching, the research, and the public engagement that we do, and our commitment to democracy, journalism, public ethics, truth, facts, diversity, and inclusion. We have a remarkable panel this evening to talk about these issues. First thing, we're still waiting for the moderator, Lisa Palmer, who actually put together this event and the series of conversations. Hopefully she will be able to join us in a few minutes. First, I want to introduce our great panel. And I will go very quickly, and then each panelist will talk for about 10 minutes. We're going to have some questions, and then we'll open up for your questions to be posted on the chat. First, I would like to introduce Laura Hellmuth, who is the editor-in-chief at Scientific American. She's a science editor who has worked for the Washington Post, the National Geographic, Slate, Smithsonian, and Science. Laura is a former president of the National Association of Science Writers and a member of the National Academy of Sciences, Engineering and Medicine Standing Committee on Advancing Science Communication. Our next speaker will be Mark Johnson, who is a health and science reporter at the Milwaukee Journal Sentinel. He was part of the team that won the 2011 Pulitzer Prize in Explanatory Reporting for a series of reports on the use of genetic technology to save a 4-year-old boy imperiled by a mysterious disease. And the next speaker will be Nancy Lapid, who has been editor in charge of the Reuters Health Medical News team since 2013. Nancy came to Thomson Reuters after decades spent in health, helping leading medical researchers write and publish manuscripts in peer-reviewed journals and presenting data at international congresses. Thank you, the three of you, for joining us. First, I will ask Laura if you want to make some remarks on the issues that we have been discussing. Laura?
Yeah, thanks so much. Thanks for organizing this event, and thanks for those of you in the audience for coming, for caring about science communication and how we can all help spread reliable, important, trustworthy information about the coronavirus pandemic. And it's been just an incredibly challenging story to cover for journalists for a lot of reasons. I mean, obviously, it's new. The virus is something we haven't encountered before. I mean, we've certainly covered pandemics, but there are a lot of things about this disease that are not expected, and it's not behaving in the way that experts thought at the very beginning of the pandemic. And it's scary, and it's really hard to communicate with people when they're scared and confused. So that means we're using all of our skills and kind of experimenting in real time to figure out how to get messages across in a way that people can hear them and comprehend them. And then the biggest challenge right now is just this pandemic landed in a moment of just massive misinformation and disinformation. And we're seeing it from the very beginning. There were conspiracy theories. There have been a lot of hoaxes about it, and these popped up faster than news stories. Really, it was from the very beginning. There was just a ton of misinformation, and some of this comes from people who are in the anti-vaccine movement. There's never been a pandemic or any situation so bad that anti-vaxxers couldn't show up and make it even worse. And so from the beginning, a lot of these people make their living off of sharing elaborate conspiracy theories about how journalists and scientists and pediatricians are in this, massive scam to poison children. It's terrible. It's ridiculous, but it's gaining ground. And because there's so much confusion, misinformation, and fear. And so they're making a lot of money. They're trying to sell you viruses vitamins or bleach, literally in some cases, and just raising, just providing misinformation where people really need good information. So there's that kind of grassroots or monetized misinformation. And then unfortunately, we're also seeing it from the highest levels of government. Donald Trump has been repeating conspiracy theories, and he's also been stoking racism and xenophobia, blaming China, and others in his administration too, are just sharing a lot of bad information at a time, when it's never been more important to have just clear, trustworthy, up-to-date, actionable information. So this is kind of the atmosphere in which journalists have been trying to do their jobs. And so, some of the challenges that I think we faced from the beginning. One of them is identifying the proper experts, because especially at the beginning, everybody was paying attention to the pandemic and kind of running their own models and doing what we call armchair epidemiology. And so there were a lot of people with outsized confidence, but not a lot of competence or knowledge. And so one of the tricks for reporters is figuring out, okay, who actually knows what they're talking about and who is just sure they know what they're talking about, but they don't. And there's a psychological phenomenon called the Dunning-Kruger effect, which shows that there's an inverse relationship between somebody's knowledge of a subject and how confident they are in their knowledge. It doesn't always happen, but it happened a lot at the beginning of the coronavirus pandemic. So identifying the proper experts, and then of course there's just been a deluge of science. It's happening very fast, and this is great. I mean, scientists around the world are collaborating, they're pushing out their data. Speed matters, and so they're publishing their information they're putting it on preprint servers. So before it goes through peer review, they're sharing their data. And the people who work at scientific journals, who are supposed to vet all these submissions, their workloads increased by 100-fold in the space of a couple of weeks and have not really slowed down. So there's just been a massive challenge within the science and scientific publishing industry to try to figure out how to identify the most reliable information and share it. And so for reporters, we're dealing with information that maybe isn't as vetted as an article that's typically appearing in Science or Nature or Journal of the American Medical Association. So we're having to do kind of our own peer review too, and talking to experts who weren't involved in a publication to get them to sort of do additional layers of peer review, so that we can make sense of the science that's coming out. And of course, everybody's busy. The reporters are overwhelmed, and all the experts we're calling on have, this is their Super Bowl, their Olympics, their, everything, their presidential election all rolled up into one. So they're busy too. So everybody's just been sprinting all year to try and do this right. And for the most part, people have really good intentions and are working really hard, but there's just a lot of opportunity for confusion. And so we're having to, check our work, update our information a lot. And so this is one of the biggest challenges, I think, is there's this phenomenon called anchoring bias, where if you learn about some new subject, the first details you learn tend to be super sticky. Those are the ones that you remember, and it's really hard to update those. So if you think about the early days of the pandemic, the first advice from public health officials was wash your hands, sing happy birthday twice. You don't need to wear a mask. In fact, don't, because there's a shortage, and we want to make sure the masks are available to people who are actually working in healthcare. So just wash your hands, you'll be okay, don't touch your face. And it took a while to realize that actually it's in the air. And it can be spread by people who don't have a fever, who aren't coughing, who aren't sneezing, who are just singing or speaking or breathing. They're the ones who are spreading this virus. And so we've had to say again and again and again, yes, we said it wasn't in the air. Turns out it is in the air. So wear a mask, and just constantly updating that sort of information. And then I think one of the biggest things to come out of this pandemic is something that health reporters have known, which is that there are just horrible disparities in healthcare and health outcomes for Black people and white people in the United States. And in some parts of the other parts of the world, you see some of these disparities, but it's super stark in the U.S. And it has been for a very long time. But this pandemic has really revealed the fact that racism is a terrible like health risk, and it's partly it's systemic racism. It's not having access to proper health care, living in having a greater risk of living in environments that are polluted, living with the stress of constant racism for your whole life. So there's a lot of reasons why we're seeing much worse outcomes for Black people who are more likely to have to die or to get seriously ill from the disease. And so that's something that I think health reporters have really been trying to amplify and explain and make the world understand. So those are that's kind of some of the things we've been trying to do at Scientific American. But I'll stop so we can start the conversation, and I'm eager to hear from Mark and Nancy too.
Thank you very much, Laura. Mark, do you want to go next, please?
Sure. I think a lot of what Laura said is very true, and I'm coming at it from a different position. On my paper, we don't have a science editor, and for the first 5 or 6 months of the pandemic, our other health science reporter was on a fellowship. So a lot of the time, I kind of felt like I was on this high wire. My editors, on the one hand, were giving me enormous trust, which was great. On the other hand, every day I'd look at the New York Times, the Washington Post, Scientific America, Ed Young at the Atlantic, Stat, and I just feel like, oh God, they're all doing a great job. They have a ton of stuff. So what can I do here in Milwaukee? And I think the one good thing I had sort of going for me was that in 2017, I had a O'Brien Fellowship and some Pulitzer-centric grants that helped me study report on zoonotic diseases from Kenya, Uganda, and Brazil. So I had some background going in. And I kind of tried to decide early on. I thought maybe what I can do is try to make my COVID stories as much forward-looking as I can, try to anticipate issues that are confusing or frightening readers, and maybe try to make them feel a little smarter and a little better informed about what's coming down the road. Those things are, of course, easier said than done. And I had to I've split my time between dailies and enterprise stories that have been, I pulled together in a couple of weeks. Dailies have been things like developments with clinical trials of survivor plasma. Fairly early on, I was lucky to make some contact with some of the folks at Johns Hopkins and Mayo who were launching the push for clinical trials of survivor plasma. So I kind of followed that fairly closely. Plus, we had one of the clinical trials is taking place at University of Wisconsin in Madison. Another daily, as far as other dailies I've looked toward, generally I look for reports, studies that are either, very interesting, COVID toe, why men have higher rates of COVID than women, but also, as Laura brought up, we now have to keep track of sites like medRxiv, where you have preprints, and you have to make these judgments about whether you go with something that, normally I wouldn't be running information on stories that haven't been peer reviewed. But in this set of circumstances, I kind of made a decision early on that I felt it was more important to tell people what the scientists were doing than to take too much of a paternalistic approach and say nothing is a story until it's been peer reviewed. I've tried to be very careful about the ones that I've picked that are not peer reviewed. They have to have something, pretty compelling, or something that's causing generally I'm looking for scientists who are looking at things a little differently. One of the ones I've followed kind of closely, a team led by a guy at University of California in San Francisco, who, when a lot of the scientific community was focusing on the proteins in the virus itself, especially the spike protein, he and his team were focusing on human proteins and looking at what human proteins the virus needs, what proteins maybe they can stop the virus by depriving it of or blocking it from using. His work was interesting, so I've kind of followed it along. As far as enterprise stories, like I said, I've tried to, most of what I've tried to do is look a little bit ahead, or at least try to anticipate what's coming down the road. In the first week of March, I did a story on some other, and other publications have done stories on this as well. It was a military study that was commissioned in, I think, 2005, of communities that during the 1918 Spanish flu took extreme measures, and as a result had very extremely low rates of infection, if any infections at all. And I kind of looked at whether, are these things that we're likely to see? Are these decisions that we might be making? It was really interesting because a lot of the scientists that I talked to, the story ran on March 7th, and most of the scientists I talked to were pretty skeptical about communities taking measures, like Wuhan had taken, and like some of these communities did in 1918. And March 8th, a huge section of northern Italy goes into lockdown. And suddenly these things that we don't think are possible or seem inconceivable, they're sort of on the table. They're conceivable. I did a profile in May of the virus. I tried to sort of look at what we knew about it by then, and with an eye towards what are scientists up against as they try to search for treatments and vaccines against the virus. What sort of special features does this virus have that have made it so devastating and effective? At the end of May, we're starting to see, a lot of the communities are reopening. A lot of states are reopening. And so I was thinking that it's possible they're going to see more flu cases again. So I did a story, a kind of 1 week or 2 week story, looking at how much have hospitals learned in the 4 or 5 months we've had so far to learn about treatments, what seems to be working and what isn't, and how much better a position are they in now in May than they were back in February, January, February, March, when the very earliest cases are coming in. I then, I think it was in July, I did a story looking at this whole issue of whether the virus is likely to become endemic. Now, actually, a lot of scientists already believe it has become endemic, but I wanted to do a story sort of looking at what that means, why a virus becoming endemic is important, what the term means, and what it's going to mean in terms of basically our daily life. It was, I think, one of the first stories that I've done that looked I had people saying that a lot of the measures we're taking, this is not something that we're going to look back in the fall and say, boy, wasn't that weird? That we're probably looking at a different kind of life for 2 or 3 years, possibly more. After that story came out, I knew it would worry people, but you want to give people sort of as clear-eyed a view as you can. I did a story basically taking off on a question that I'd seen from some readers, looking at how difficult it is to eradicate a disease. And we've actually, in the history of medicine, we've only eradicated 2 diseases, smallpox and an animal disease called rinderpest. And so I looked at how much money and what kind of effort had to be put in to accomplish those things. The 40th anniversary of the declaration that smallpox had been eradicated actually came in the midst of the coronavirus. And I think that, it hadn't even occurred to me. I completely missed it. But in going back to do this story, I noticed that it had come up, and it was very interesting to look at just how enormous an undertaking it is to wipe a disease off the face of the earth. The last sort of longer enterprise thing I did was in early September. We're getting more and more information from both the CDC and a lot of the virus makers that they keep telling us, a virus is coming soon, is coming soon. At one point, it was going to be in September, October. Now it might be October, November, but probably December, or more likely next year. And I kind of looked at I tried to look at what the accelerated process of developing and testing and approving viruses or vaccines, what effect that's likely to have on the vaccines that we see. Are the first crop of vaccines likely to be very effective? I kind of sort of combined that with looking at how complex a matter it is to plan a huge vaccination campaign. I mean, I had been sort of thinking myself that, we get to this stage when there's a vaccine, and then, everybody just marches off to large, National Guard facilities or things like that and gets vaccinated. And there's a whole, it's so much more complex than that. There are all these ethical quandaries. What groups should get the vaccine first? What groups are vital workers, and do we give them greater consideration than we give to those who are most vulnerable and are sort of suffering from the disease disproportionately? As Laura mentioned, African Americans, Hispanics, American Indians as well. And it turns out that just trying to sort through that, we're going to have a good chunk of the population, as many as 100 million people, who fit one of the categories. Either they're considered a vital workforce, they're extremely, vulnerable, or have had, or are in a group that has been inordinately affected by COVID-19. So I don't know. A lot of the time, I spend a lot of time looking at what's in the big papers and smacking my forehead. I can't believe it. Oh, geez. One whole area we were completely unsuccessful on. Very early on, a photographer and I bought PPEs, basically so that we could try to get into one of the local hospitals and actually see what was going on a COVID ward. And even with PPEs, which I thought would, take the sort of liability, issue off the table, we just weren't able to convince anybody.
Mark?
Yeah.
Thank you very much. I think if we can move next to Nancy.
Oh, absolutely, sure.
Okay, and then we'll come back to you. I'm sure we have questions, and I'm sure the participants have questions as well. Nancy,
Sure.
if you want to share with us your thoughts on the work that you have been doing.
Sure. I'm going to tell you a little about myself and my role at Reuters. And then I'll talk a little bit about how Reuters has sort of reorganized itself a little bit to cover the pandemic. And Reuters, I actually work for a team at Reuters called Reuters Health. And Reuters Health was founded in the early 1990s as a news service for physicians reporting on medical research. And the Reuters Health clients also had access to other medical-related stories produced at Reuters. Generally, those were about health policy, regulatory ruling, mergers, judicial and legal stories related to healthcare, and research that was market moving, that would have an impact on the stock market. Most members of my Reuters Health team didn't come up through the usual journalism pipeline. Most of us have some sort of science or medical background without formal journalism training. As for myself, I knew when I was 15 that I wanted to be a journalist, but the college I went to didn't have a journalism program. So I actually majored in economics, and I got a job as a typist for a financial publishing company. And that's, you can tell how old I am that I had a job as a typist. And then I got a job as a copy editor at Scientific American, actually, and I stayed there. I stayed there for 10 years. And at the time, Scientific American had a medical publishing division. And I ended up directing a joint project for Scientific American and the American College of Surgeons. When I left Scientific American, I became a freelancer for the next 18 years, and I helped academic surgeons and other medical researchers write up their papers and their grants. And I was also reporting as a freelancer for Reuters Health. 10 years ago, I got hired by Reuters full-time as an editor, and I've been the editor in charge of this group since 2013. And I just want to stop for a minute and mention with regard to best practices, because Lisa, our moderator, had asked me to just mention best practices. And I want to say, as for health journalism, if you're not familiar with this site, you should become familiar with a site called healthnewsreview.org. Healthnewsreview.org is a fabulous resource for ethical and objective health journalism, with criteria what criteria makes a good story, and a toolkit for research, for understanding research and study design and medical statistics and other resources for health journalists. And that's at healthnewsreview.org. So until this year, for a variety of reasons, Reuters Health was not integrated with the rest of Reuters. So we had our clients and our goals, and we aim to meet all these criteria from Health News Review. We do multiple interviews. We'd have a lot of perspective in our stories. And the Reuters pharmaceutical and companies reporters had their goals. Ours was to cover medical research in general, trying to maintain these high standards. But the rest of Reuters wasn't writing for doctors and patients. They were writing for investors and businesses largely. They wrote short and sweet. 300 words was the average story. Longer than 300 words, they needed to get permission. We churned stories out on very tight deadlines, multiple stories a day. So the things that we felt were important to our Reuters Health readers, the content that added perspective, was often not included in the regular Reuters stories. Then came the coronavirus. Usually, the general news team would handle big news stories, even medical news. But the coronavirus, it was too big and too complicated, and it affected, as I don't have to tell you, it affected every aspect of life. And Reuters quickly realized that the general news team needed help from the health reporters, the pharmaceutical reporters, and my team, the reporters and editors who know the difference between DNA and RNA and passive versus innate immunity and the difference between T cells and antibodies, the company declared a news emergency. I can tell you in my 10 years at Reuters, I had maybe written 5 stories. I'm an editor. I'd maybe written 5 stories and none for the main Reuters wire. And all of a sudden, every day, my Reuters health colleague, Christine Suarez, another Scientific American alumna, and I were writing stories for the wire and collaborating with the regular Reuters editors to help edit wire stories that were coming from our bureaus around the world about coronavirus and related issues. And of course, all the bureaus were actually closed because of the lockdowns. So Reuters was using a program called Microsoft Teams to create virtual bureaus. And the bureaus would hand off responsibility as the Earth rotated from the London bureau to New York to San Francisco to Singapore to Beijing to Bangalore. And some of the business editors in each of these countries were pulled off their regular beats and reassigned to the COVID team to help organize the flow of stories and the assignments. What did we cover? First, well, for Reuters health professional clients, for the physicians, for months we shifted to mainly covering COVID research because it was so important and nothing was known about the virus. Everything was new. How did it affect the heart, the nervous system, the kidneys? What were the risks for people with cancer or immune disorders? How was it transmitted? Was it safe for people who needed operations to get them? Why were all these young people having strokes? What can we use for treatment? And the same issues that Mark touched on, what kind of, and Laura, who do you trust? What kind of researchers do you look for? What kind of studies? I mean, some of these issues we deal with every day because we're covering medical research study. What makes a good study? We know observational, the whole issue with hydroxychloroquine, which until it was tested in randomized trials, people were saying, some people said it worked, some people said it didn't work. We needed to wait for the randomized trials. Observational studies can't prove cause and effect. So these were the kinds of things we were sharing with our colleagues at Reuters who were not used to reporting on medical news. The general public wanted the same information that doctors wanted, but the Reuters reporters who wrote it for the public had a hard time understanding the medical terminology and translating it, so we worked with them. Things have settled down now. Not every story coming out of, it's not like 90% of the stories coming out of Reuters now are about COVID, but we still are working, we have the reorganization, having all the health reporters work with the general news team is still ongoing, and we think that the quality of the stories that we're providing for clients has benefited from that. And before I finish, I'll share with you sort of a quandary, a real world quandary, because here I am, a proponent of balanced medical news stories that have interviews that say the pros and the cons and discuss the limitations of the studies. And I was asked back in April to do what Reuters has been calling its COVID research roundup. 3 days a week, Monday, Wednesday, and Friday, I write a roundup of medical research related to COVID. Research studies that are not being covered in large stories. So my bosses wanted these roundups to be about 3 to 5 different short items on 3 to 5 different studies in every day. Mm-hmm. Each of them, like each 200 words. Here I am wanting to do, I said to them, let's not do it this way. Let's do one every day, focus on one topic. I'll give them, we'll get different interviews. We'll say what different research teams are working on, how people are coming together. We'll put it in perspective. The top people said, no one's going to read that. We want the short blurbs. So I'm writing these short blurbs. They're very popular. They're easy to read. Everybody likes them. I feel a little bit like I'm feeding ice cream to children for dinner. Of course they like it. good for you. And I'm trying to do a balanced job. My 200-word items are accurate. I'm enjoying doing it, but this is a real world quandary. We don't have the resources to cover all of these stories. There's interesting news. We have a link at the end of every item. There's a link to the original paper, so people can go back and read more. But I'll just leave you with that quandary. Here I am. I'm finally, after wanting since I was 15 to be a journalist, I'm writing every day for the Reuters Wire. But this is the
Thank you very much, Nancy. Thank you. Let's see if we can bring in Lisa Palmer, who is the moderator for this panel. She has some technical difficulties. I don't know if Doug can bring her in. Is that possible, Lisa? Are you there?
I'm here. I can hear you now, and hopefully you can hear me.
Okay, that's great. So as I mentioned earlier, Lisa is the moderator of this panel, so I will hand the mic, the camera to her. Lisa is the National Geographic Visiting Professor of Science Communication at the school where she teaches science communication and science reporting. I'll go on her bio, but in the interest of time, Lisa, why don't you take it away, please?
Oh, thank you so much, and hopefully you can hear me okay?
Yeah, we can hear you okay.
Great. Well, I've really appreciated everyone's input so far, and I wanted to just offer some follow-up for the panel, some follow-up questions, and hopefully they can respond. And so I think I can share my video now as well. So give me a second here. I'm hoping to. Hi, everybody. So, I think a couple of things I wanted to follow up on, especially this week. There has been some breaking news at Scientific American, where Scientific American has supported a presidential candidate for the first time. And I'm wondering if, Laura, you can comment on that, why it was so needed, and why at this time, especially at this time in our history, this is such an important perspective to have.
Oh, thanks for asking. Yeah, we just celebrated our 175th anniversary. We're the oldest continuously published magazine in the U.S., and until now, we had never endorsed a political candidate. So we've commented a lot on policy issues and politics issues, but haven't gone for a specific candidate. But this year, we decided that Donald Trump's administration has been so bad for science, for climate change, for the environment, and especially for public health during the pandemic, that we felt like it was our responsibility to use our platform to urge people to vote for Joe Biden, who's much more, he has reasonable policies that are evidence-based and are not conspiracy theories. So the response has been pretty positive. We were afraid that there would be a lot of pushback and a lot of aggression about it, but actually people have been have understood and recognized that this isn't a typical election. And we tried to make it nonpartisan. We didn't even use the words Republican or Democrat. We just really talked about these two individuals, hoping that even people who consider themselves Republicans will recognize that, in this election, if you really want to be guided by science, especially to science our way out of this pandemic, that Biden's the choice.
Mm-hmm. And I guess following up on that, with regard to the stories that you're publishing at Scientific American, and also talking a little bit about your past history at Washington Post, and in full disclosure, I've worked for Laura back when she was at Slate magazine, so we've known each other for a while. But how do you express urgency through evidence-based reporting, and to get the most important stories out there in the public realm? So what's your selection process?
Yeah, and that's exactly what we're aiming for, is to have the stories about the pandemic for sure, but about everything that are really the most relevant to what's happening in the world, to help policymakers make better decisions, to help readers just in general make decisions about their own lives. When do you wear a mask? When do you not wear a mask? and to vote appropriately, and to just highlight the most important social issues, political issues, environmental issues, and scientific issues. We still do lots of things on black holes and the potential for life on Venus, which is really exciting. But yeah, in this moment, and especially this year with the Black Lives Matter movement, we've been doing a lot more coverage of social science, systemic racism, police brutality, gun violence. So it's so far we have we've definitely gotten some subscribers who are not happy and really just want the black holes. But we're trying to reach more people and kind of make the connection between what the scholarship shows and how that what that means for society and for people's lives.
Mm-hmm. I have a question for Mark, and maybe others can jump in as well. What can science reporters do to maintain this scientific accuracy, especially about sort of difficult topics like vaccine development or or other types of therapeutics and treatments, while also communicating in a way that's accessible or easy to understand for the audiences that you write for?
Well, in some ways, I have my own ignorance is a bit of an advantage. I was terrible at science in high school, and I didn't take any in college. As a result of that, I ask a ton of questions, and if any scientist can succeed in getting me to understand a concept, then I'm usually pretty confident I should be able to explain it to people in Milwaukee. They're pretty smart. Mm-hmm. But there are a lot of difficult decisions. The fact that I don't have a science editor and that I'm kind of assigning myself stories does make me worry at times. It's nice having the freedom, but on the other hand, I worry if I'm putting too much stock in an idea, or if I'm not, you constantly, especially in this atmosphere, you constantly have to remind people that this is a really extraordinary time, and that it's not just the preprints we're seeing, but even the peer-reviewed papers are getting peer-reviewed in days. It seems like hours sometimes. And so there are going to be huge mistakes. It's entirely possible that the first vaccine or two that we get will be not very good. A lot of people don't realize that there are vaccines out there that just aren't very effective. I believe it's the malaria vaccine is something like 40%. It's not very effective at all. And I think a lot of people are expecting the vaccine is going to be 100% effective. I don't know. I try to ask as much as I can the questions that kind of I have and that I hear people ask, and I try to be really, really careful about concepts that I don't understand. I just keep asking questions until I do understand them.
So I guess that goes on to my next question, which has to do about kind of how you deal with the skeptical public, or a public who's skeptical of science in general. Like, because science is constantly changing. You're talking about how it's been sort of more accelerated in the peer review process. Seems reasonable for us science reporters to know that there are adjustments and things that get updated from time to time, but readers may think that there's just been a flip-flop or a switch. So how do you get to that nuance in your reporting?
Well, one of the things that I think accounts for the distrust people have of scientists, and I think it goes beyond scientists. In general, I think we tend to distrust the things that we don't understand. If there's something, I don't know, in some ways, maybe it's a convenient fallback. It's a way of justifying something to ourselves. But I try, especially when I get replies, for instance, that assess what I'm writing about on a political scale. I've sort of developed a stock response, which is that, that a virus isn't a political issue. It's not a Democratic issue. It's not a Republican issue. It's not an issue at all. It's a force of nature. And I try as much as possible to get people to think along those lines.
Mm-hmm.
I don't know if I answered you.
Right. Yeah. Thank you. That's great. That's a great perspective. Nancy, I wanted to follow up with you and also maybe hear from Laura regarding some of the most challenging issues or concepts about COVID that has needed to be broken down in order to be understood by your audiences. I know, Nancy, you had told me about some of this, so these smaller chunked graphics pieces that you're working on at Reuters Health. And I know that Scientific American also does a lot of visuals. So what are the ways that you are being able to talk about some of these elements of COVID-19 and coronavirus through sort of visual storytelling?
Well, we have a large graphics team, and we have a vaccine tracker. We have a medical sort of a treatment pipeline graphic. We also have, these are not graphics, but we have certain texts that they call explainers, where it's just a question and answer format, which is simpler to understand. I would say, to sort of blend back into the question that Mark was just answering, I think it's very important. A lot of people don't understand that advances in medicine and science are so incremental. I mean, we tend to run stories with big headlines and everybody thinks that the deal is settled, the answer's been found. And then it's not really the case. I mean, in the real world, in medicine, some study shows something, even if it's a gold standard randomized trial, people don't trust it until the next few gold standard randomized trials show the same thing in different groups of people. Mm-hmm. And those don't keep grabbing headlines, and a lot of editors don't let reporters keep reporting. They'll say, we've said this already. But in the real world, these incremental advances are really what we need to know about and understand.
Laura,
and I think that's hard to convey to people too. They're not used to understanding that.
Yeah. Laura, have you approached that from both being at Washington Post and then Scientific American? Have you approached those incremental understandings as well as sort of that visual component to help drive the story?
Yes, the incremental advances. There's a kind of a headline trope that we've been using, that I used at the Post, that we're using at Scientific American, and I see a lot of other publications also. And the formula is: here's what we know right now, or here are 9 things we've learned. Here's what we know so far, and it basically, by framing it that way, you're saying, everything's in flux. Our knowledge is in flux. Here are the most recent things we've learned. And it's sort of an implicit promise that we're going to come back and tell you the next things we've learned when there's more to say. And it's a little bit humble. Like, here's what we know so far, kind of acknowledging there's a lot we don't know. So here's what we do know. Here's what we don't know. So that's a lot of it. And just kind of also, you can't do this in every story, but trying to humanize it and show the scientists who are working hard and the clinicians, sometimes kind of experimenting in real time, trying to figure out, how to understand the virus, how to treat people with it, and just show that everybody's, doing the best they can in very uncertain circumstances, and kind of make people understand that it's a kind of a human confusion, and we're just telling you everything we can as soon as we really know it.
Mm-hmm. Are you able to talk about anything you've done or other sort of scientific or media organizations that you've known to discuss how maybe the coronavirus pandemic has been, or how can the reporting of science of the coronavirus pandemic combat some of this online disinformation about it? Like, is there any kind of feedback that you're seeing people try to do on that?
Yeah, we've definitely been tackling that a lot, and using the kind of tropes of kind of easy to understand journalism, we have a story called like 9 myths that won't go away. And a lot of places have done this. They've done just lists. Here's 27 lies that are circulating about the coronavirus, so that people go into those stories, prepared to see things that are false, and then just doing bullet points. This is wrong. Here's why it's wrong. Here's why people believe it. To sort of use the science of misinformation, and the science of what are the best techniques to debunk false information, to try to do it in a way that doesn't just amplify false things, but like helps people understand, okay, this is wrong, here's why, and here's what's actually true.
I guess anyone else using that type of approach to combat disinformation on the panel?
I feel like all of us are probably, everything we're doing is every day is we're trying to combat misinformation in different ways.
Yeah, I guess, to wrap things up, I just want to see if each of you can talk to the journalists out here who are reporting on this, to the students or journalism students who are starting to report on health and other important science and information. Sort of, what are some key takeaways that you would say that this coverage of this pandemic has helped you learn? Like, what are some things that you've learned, but also what's next for you? What is the next thing that you want to focus your attention on regarding the pandemic and the coverage of it? So that will go out to each of you. So I guess we'll start with you, Nancy, and then work our way back through everybody else.
What I've learned, certainly I've learned, I was more familiar with covering stories in clinical medicine. I was not used to I have not been covering as much about the basic science and the biochemistry and the virology and even immunology. And I've learned a lot because that's so key to understanding this virus. And that sort of ties into what's important, whether you're at my stage or whether you're just beginning to report on medical topics, is to really develop your sources. Have good people that you can check with, have people who can tell you what's junk and what's worthwhile, find ways to monitor what other researchers are saying is important. And I would say developing good sources is a very important way to support yourself.
Mm-hmm. Great. Mark?
One of the things I've learned it all the time in science reporting, is that it's endlessly humbling, because even when you're able to tackle one incremental advance correctly, it's part of a huge ocean of work on that subject. And so I noticed most nights I go to bed with 1 or 2 medical papers, and I have this kind of promise I make myself. If I get through the medical papers, I then get to read then I get my dessert. I get to read a novel or something else I'm really enjoying. But it's one of the things I've also, I think, learned. It's very hard to combat the misinformation. I was really interested in what both Laura and Nancy were saying about that. The only thing, I mean, I've tried to have conversations occasionally back and forth with readers, and the one thing that I think sometimes helps is I think people want to feel smarter. And I try to think about that as I'm writing. Can I write a story in such a way that people come away knowing something about the virus that's true and that they'll want to repeat to somebody else? It's just, it's a much, much smaller version of the way I think, people years ago would take a great deal of pride if they could understand relativity. You'd look really great at a cocktail party if you could actually, say that you understood it or fake your way through it. And I think that we have to remember that there's still knowledge is something powerful, and even in this day and age, it's still something that can make people feel good.
That's great. Laura.
Yeah, thank you. So especially for all the people who are interested in practicing journalism and doing communication of any kind, and for people who are just reading journalism or sharing information on social media, I think one of the bits of advice that is taught in journalism is that you should give both sides of a controversy, give both sides of every story. Sometimes there aren't both sides, and in science we really see that. When you're talking about evolution, you don't have to give the other side of creationism. If you're writing about climate science, you don't have to give, and please don't give the climate science skeptics. In science, sometimes there are things we know, and you should just say what you know. And if something's a lie, you can call it a lie. If something's racist, you can call it racist. And I think in the last few years, the kind of norms of journalism are finally starting to catch up with the misinformation and the weaponized, xenophobia and bad behavior and othering that we've seen a lot of from politics. So it's really important to use your knowledge and to be very clear and not just present some version of objectivity, but present the truth as well as you know it.
Well, thank you all panelists so much for joining us today. Apologies for my technical difficulties. This is, I guess, typical of being online all day. I guess my computer was fried of too many Zoom and Blackboard meetings. Maybe it's telling me something, but I just really want to thank you for joining the conversation tonight. Again, this is the first in our series of conversations in science communication that I will be hosting at GW this year. And I want to just let you know I have a lot of the links that the panelists have shared with you, and I will send those out both on social media, and we'll try to send those out, include them in some ways in a follow-up to this. And we will be posting this, I guess, as in YouTube. So look for that as well if you wanted to share it as a follow-up to archive this event. Thanks, everyone, and I appreciate you taking the time to join us here for a conversation in science.
Thanks so much.
Thanks so much.
Thank you.
Thank you, Lisa, very much. And
Thanks,
thank you,
Danielle.
everybody, for joining us. And thank you to Mark, Lisa, and Mark, Nancy, and Laura. Thank you very much for coming. See you. Bye-bye.